their first reaction was, oh, she's high on drugs. No, I wasn't high on drugs. So my husband got in there and tried to advocate for me. And eventually I got back to triage and they drew my blood after some significant amount of time. And it was discovered that I was dying. I had extreme lithium toxicity. And I don't remember, I have amnesia. I don't remember a lot of it, but I do remember them looking me in the face and saying, if you don't cooperate, you're going to die.
Welcome to the Managing Mental Health podcast. Join us as we talk to leading psychologists about all areas of mental health, and we hear from real people that have overcome real mental health struggles who can now share hope and encouragement for us all. I'm Jamie, social psychologist, author, and trauma recovery coach. Our special guest today is Maddie Andrews. Maddie is a mental health advocate, MSW student, and peer support specialist. But she's not just a professional in the field. She also has a personal story of living with serious mental illness. After a profound near-death experience, she dedicated her life to building healing, accessible, affordable, and equitable mental health services for everyone. And with this in mind, she also founded the nonprofit J&E Support Group. Maddie, welcome to the show.
Thank you so much for having me. I'm really excited.
Yeah, I'm excited to hear more about your journey, and I think our listeners will definitely not only just learn a lot from what you've experienced and how you've grown, but also be encouraged, that even with me as a social psychologist, we've all been through personal journeys and overcome challenges, and it can be done. So it's often been said, probably by me mostly, but I often say it, that people that go into psychology do so in order to figure themselves out.
Yes.
Do you think that's true?
It is so true. And I've learned so much about myself in my studies and things like that.
It's funny how we kind of gravitate towards the things that we need, and then in a lot of cases see that those are things that other people need as well, and so we go in that direction.
Right.
Which I think is, that's probably the best way, because if you need help in a certain area, it's better to have it from someone who knows what they're talking about, right?
I would agree with that 100%.
Okay. So, Maddie, just how did you get here? Tell us all about your journey.
Well, it's long and complicated, but it started when I was 4. So I had a really traumatic experience, and I told one person and they really shut me down, told me it was my fault when it wasn't. And I didn't tell my parents, and slowly I just became like really attached to my parents, overly attached. I was anxious. I wasn't sleeping. I was fearful of getting in trouble. And what I learned as an adult is I was developing PTSD from the assault. And I really lived in silence with it until I was an adult, and just went through the motions. And when I was in middle school, I started developing further symptoms. So I had a lot of paranoia, a lot of delusions. I started having auditory hallucinations. My moods were all over the place, but I was so used to not disclosing this type of information, I didn't tell my parents. And it was really hard because I started to withdraw. I was fearful that people hated me. I had a hard time believing people when they gave me positive reinforcement because of the negative delusions. And it was very troubling. And I really just didn't say anything until I was 14. I read a magazine article about a young woman with OCD. And it resonated with me because I am very much a compulsive thinker, and I very much have obsessive habits. So I told my mom, and she was very much understanding and got me with a neuropsychiatrist who did diagnose me with OCD, but I was not articulating the other symptoms. I was so young and not aware that everybody didn't have delusions, and everybody didn't have mood swings, and everybody didn't have paranoia. You only know what you know at that age.
Yeah.
So I started getting treatment when I was 14 for the OCD, and they prescribed a medication. I didn't get therapy at that time, and I continued to just kind of struggle. But by the time I was 16, I thought people lived in my bushes. I thought I was being stalked. I thought people lived in
Mm,
my vents. I was not going to the restroom. I didn't want to shower. Like, it was affecting my day-to-day life.
mm,
And my parents were noticing some mood fluctuation. And they talked to my psychiatrist, and she changed my diagnosis to to mood disorder not otherwise specified and generalized anxiety.
okay.
And there really wasn't a big change in treatment at that time. And my senior year, I really, really, really regressed. I quit the soccer team. I quit hanging out with my friends, and I was severely depressed.
Mm,
And I had this delusion that my friends hated me. So I said, I'm just going to cut contact. I'm going to go to college and start fresh.
mhm,
But unfortunately, at that time, I also became manic
mm,
and started indulging in substances and reckless behavior from the
mhm,
lack of impulse control. And I really continued on with this for a couple years. And then the psychosis became so bad, I was unable to leave my house. It
mm,
was very debilitating. And my mother found out, and I was forced to drop out of school. I came home, and I didn't know what to do with myself because the only compulsive thought I had in my brain was that I'd just be better off dead. I
mhm,
had a lot of suicidal ideations. I was self harming. And my mother was shocked when I told her this. She had no idea.
mm,
So they took me to a hospital, and they were initially treating the drugs in my system. But when I was there, I started to disclose the other symptoms, and they were trying to understand, do I have bipolar disorder or schizophrenia?
mhm,
And they diagnosed me with bipolar I disorder. They were linking the psychosis to a mania episode, a manic episode.
mhm,
Um, and when you get a diagnosis like that, it's a life-changing process. You grieve, you start
mhm,
medications with side effects, your whole life changes, and you go through so many years thinking you're one way, and then in the drop of a hat you're different. And that's a hard thing to swallow. And it was difficult to get proper care. And I really didn't get proper care until I was 35. So by the time I was 23, I had been in substance use for treatment once, the mental hospital 4 times,
mhm,
and things just were very difficult. But eventually, I was able to get back in school, obtain my bachelor's degree, get married, and I had really learned to wear this mask in public.
mm,
So the outside world wasn't aware of what went on in my head and what went on at home. But the pattern of my life is I wore this mask, and when I came home, it came off, and I was either so drained I couldn't function, or
mhm,
my moods were completely all over the place. And I
mm,
took everything out on my family. And my doctor, unbeknownst to me in my late 20s, changed my diagnosis to what's called schizoaffective bipolar type. And what that means is I live with symptoms of both schizophrenia and bipolar disorder.
mhm,
And that was an even harder pill to swallow. I was very afraid of the word schizophrenia,
mhm,
and I didn't understand what schizoaffective meant. And it was not really, they used jargon to explain it to me. They read me the
mhm,
DSM, and that wasn't helpful at all. Like, I needed somebody to sit down and say, this is what this means in
uh-huh,
layman's terms. They just weren't doing that. And my doctor's initial reaction was just to tell me I shouldn't have children. Like, that was her biggest concern. Even though I was a teacher, I was a productive member of society. So
mhm,
because I had this label, that was her main focus.
uh,
And she continued with some pretty I think unethical treatment for the 20 years I saw her.
mm,
But in my late 20s and early 30s, I was 420 pounds. I couldn't process emotions. I was numb to the world. I was had a ton of suicidal ideation, self harming,
mm,
extreme psychosis. I was not living. I call it living to survive. I was going through the motions.
yeah,
And it was very difficult. Living was painful. But in 2023, my doctor called, and at this time I was on like 10 to 15 meds, all maxed out. And she
mm,
said, "Oh, there's a new drug. I want you to try it." what's one more, right? I'm already on all these others.
Yeah, why
I,
not?
why not? So I tried it, and it was a brand new drug. And the beauty of this drug is it doesn't block all your dopamine. I think it's only 40% of your receptors are blocked.
Uh-huh.
So when I tried it, I started processing emotions. I started feeling motivated, and I did so well. She took me off other medications, but when you live with schizoaffective bipolar type, you have to treat mania, depression, and psychosis.
Okay.
But she took me off my mania medication, and
Oh,
I didn't realize that I was becoming manic until it was too late.
uh-oh.
And I reached out about 4 months later, and I was like, something's wrong. I need help. And
Mm,
it was brushed off. And by the time I could really self advocate, I was not only severely manic, I was severely psychotic.
mm,
And I really had to put my foot down for the first time in my life and say, I cannot work. This is unsafe.
uh-huh.
This is not okay. And so I was written out of work, and my husband was also written out of work. He was designated to be my 24/7 caretaker because it was unsafe.
Mm,
Um, and her first reaction was to give me multiple sedatives at a high dose. Well, when you have substance use history, that's a really bad idea.
yeah.
So I ended up relapsing because I had 3 sedatives and as much as I wanted, and I was so sick. You know, I just wanted to feel better, and they numbed me and they
Yeah.
calmed me. So I overindulged, and I spent quite a significant amount of time stuck in the bed, unable to drive, only seeing life in the form of hallucinations,
Mm,
very, very sick. And it didn't work. That treatment didn't work. So she then decided to increase a medication called lithium. Well,
mm-hmm.
lithium is a heavy metal, and part of lithium treatment is that you have to get blood levels checked periodically to make sure you're okay, your kidney, your liver, you're not toxic.
Mm-hmm.
And she gave me a ton more lithium and did not check my levels.
Oh.
And pretty quickly thereafter, I couldn't talk. I was in diapers. I couldn't
Mm,
swallow. I was entering like this vegetative state almost. And
wow.
at this, yeah, it was bad. Like it was really bad. And my husband would put me on video call with her, and I really couldn't talk, and I was
Okay.
drooling. And she would say, "Oh, just stay home and rest. It's okay." My husband wasn't educated enough to understand what was happening.
Uh-huh.
So it created a lot of conflict in our marriage.
Mm,
And one day I was supposed to go to therapy. My therapist was great and was actually helping me as much as she could.
mm-hmm.
And I missed my appointment, and I gathered enough strength to try to say, take me to the hospital. And my husband said, you want to go to the hospital? And I said, yes.
Mm-hmm.
So he rushed me to a local mental hospital where I walked in covered in vomit, unable to talk, unable to sign myself in because I couldn't write.
Mm,
And they quickly established that this was out of their scope of work, right? This was something way bigger. They called an ambulance, but it didn't come. So my husband rushed me to the ER. And my husband parked the truck, and I walked in, and here comes somebody stumbling in, covered in vomit, unable to talk. And their first reaction was, oh, she's high on drugs.
mm,
No, I wasn't high on drugs. So my husband got in there and tried to advocate for me. And eventually I got back to triage, and they drew my blood after some significant amount of time, and it was discovered that I was dying. I had
mm.
extreme lithium toxicity.
Oh,
And I don't remember, I have amnesia. I don't remember a lot of it, but I do remember them looking me in the face and saying, if you don't cooperate, you're going to die.
goodness.
And yeah, so they called poison control, and poison control was like fluids. Fluids is the first form of treatment. So I was also combative. So I
Mhm.
was in the ER for 3 days, tied to a bed, and they were flushing me full of fluids, but it wasn't working. So when they continue too many fluids, it enlarged my heart and put a strain on it. And when your heart's enlarged and failing and you're continuing fluids, it's going to make your lungs collapse. And the bottom half of my lungs collapsed.
Oh, gosh.
Yeah. And I was alone. They told my husband not to come to the hospital. I was in and out of consciousness.
Mm,
It was very scary. And I would wake up, and I was tied to the bed, and I had no idea where I was, and I couldn't
yeah.
talk. And it was horrifying. And then eventually they called poison control back and they're like, the fluids aren't working.
Uh-huh.
So they ordered dialysis, and I ended up with 2 rounds of dialysis to clear the lithium. And at this point, I was in the ICU, and the problem was I wasn't responsive when they got the lithium out.
Uh-huh.
So they did an EEG, which showed very little brain activity. And my husband was actively grieving because it looked like I was either going to die or have
Mm.
silent syndrome,
Yeah.
which means I was going to regress and never recover.
Right.
So I spent 2 weeks in the ICU like that. And then one day I kind of woke up a little bit. I had
Mm-hmm.
no short term memory. I couldn't talk very
Mm-hmm.
well. PT was teaching me how to walk again. And but I woke up.
Mm-hmm.
And that day they transferred me to the mental hospital because the ICU had done all they could. The lithium was gone.
Uh-huh.
But in the ICU, they stopped all my meds. So I needed to go somewhere to restart them. So I get there and I'm there for like a couple hours before they rushed me back to the hospital. What they didn't understand, what nobody understood, was that I had a brain injury and I didn't even understand what a toilet was. So they found me over my bed like a zombie, talking to myself and urinating on the floor, and they didn't know what to do. So
Uh-huh.
they took me back to the ER, and the ER said the lithium's gone, nothing we can do. So I went back to the mental hospital. But really, this is where the story turns around because
Okay.
started to tell me a little bit what happened. And although I wasn't getting the true supports I needed there, I gave myself the support. So they had given
Uh-huh.
me pencil and paper, and I couldn't write. So I practiced writing my name all day, every day until I taught myself how. And the nurse had written down phone numbers there because there you can't have a cell phone.
Mm-hmm.
So I practiced reading and inputting into the landline, reading and inputting. And when I was able to make a call, I practiced talking.
Mm-hmm.
And I did exceptionally well. And it looked like maybe I'm not going to have silent syndrome, but it's going to take a really significant amount of time for me to relearn these basic skills. Like
Yeah.
when I tried talking, I couldn't breathe. So I would get very lightheaded if I tried to talk. My speech was very inhibited.
Uh-huh.
And I spent about a week there. And when I came home, I really had no idea the full scope of what had happened to me, but physically I felt very sick.
Uh-huh.
And I just thought I was dying. Like, and so I begged, I just end it now. Like I know I'm dying.
Yeah.
And one day, when I learned to read again, I read my medical records and found out everything that happened to me. And
Uh-huh.
a fire burns in my belly. And I said, this is not the end. I
Yeah.
had spent so many years of my life feeling like death was the only option, and it turned
Mm.
around on that day.
Mm.
I'm going to live. I'm going to heal my heart. I'm going to heal my lungs, and I'm going to heal my brain.
Mm-hmm.
And I got up and I walked for 30 seconds. That's all I could do, but I did it, which led to a minute, which led to and more time, led to running 5 miles a day when I was 420 pounds.
Oh, wow.
Yeah, and I got on the phone and I begged for help. Please give me a new doctor. Please find me resources. I'm willing to do anything.
Uh-huh.
And I got hooked up with a neurologist, got an MRI, found a day treatment program, found a new team of psych doctors.
Mm-hmm.
And along the way, I really thought I have to travel like an hour or more to see these people. And I was like, why in my area are there not more resources?
Mm-hmm.
And why is it that I was coached for so long to be quiet about all this? Why is this not being discussed more? So my first step was I'm going to talk about it.
Yeah.
I'm going to be open.
That's so much, such a powerful story. And I want to get caught back up a little bit to where we're at in terms of your advocacy and your nonprofit and stuff. But I'd like to go back because there's so many amazing things that you mentioned and so many important aspects. Um, like even at the beginning, you know, when you were a child and going into teenage years, you mentioned that you lived in silence. And I think that's something very common for people, especially from childhood trauma. Adult trauma, it's a little bit different, but can still feel that way. But when you said, you lived in silence, what did that feel like going through that? And did it feel like you couldn't talk about issues or just didn't want to talk about issues or maybe some of both?
Well, initially, after my initial incident, I did try to talk about it. I told my preschool teacher what happened to me, and
Mm,
she told me that I was a very bad girl and it was all my fault. And
mm,
if I told anybody, I would be in big trouble. And it
mm.
really taught me to be quiet. So I felt like for the rest of my life, I just couldn't talk about these things. And it created this deep rooted fear in me about being a bad person and being in trouble
Yeah.
if I did say something.
Yeah. So you're basically shamed into thinking it's your fault and then the silencing. And yes, especially as a child, when someone tells you that, you take it for granted or you take it on authority in a sense
Right.
that, yeah, okay, well, I'm supposed to obey and I shouldn't. And I think there's a lot of people who have had stories of childhood abuse, trauma, sexual abuse, you name it, neglect, and have tried to tell someone and basically been disbelieved or, you know, told to be quiet about it, like your case. So for adults in the field, whether it be education, whether it be family members, if you have a child telling you something, um, at least take the time to sit down and listen. Even if you don't jump from, A to Z immediately, listen and give them a chance to tell you what they're thinking, feeling, what's happened, and then start reaching out more from there and seeing because a child's not normally going to tell you something bad that happened that didn't happen. That's just not the norm. Um, I think we see too many TV shows and stuff about the one or two cases where it didn't actually happen, but I mean, out of 100, you're literally talking one or two. Most of them, they're saying something for a reason. Uh,
Yeah, I think she was fearful that she was going to get in trouble. I was sexually assaulted on her watch.
mhm.
And when I told her, she didn't want me to tell my parents and get in trouble, is I believe the reasoning behind what she said to me.
Yep, could be. Yep. Yeah, you never know why people are saying things like that. I know in my case, when I was a teenager and tried to talk to some of my extended family about the way my father treated me, they were just like, "Well, you're a bad child. You just want attention. You're the black sheep of the family, and blah blah blah." So it was more a defense of him as their family member and treating me as the outsider. And so it was just total disbelief, like I was making it up or whatever. So yeah, people say stuff like that, and who knows the reason why. But for us listening now, for the audience, again, if you have a child coming to you and saying something, listen, because they're not making it up. There's a reason for that. Um, you also mentioned, and I think this is extremely important. You mentioned the idea of grief, and we generally think of grief when we're talking in terms of somebody died. So your parents died, your your spouse, your brother, even a child. It's kind of a given. It's kind of easy to understand grief in those terms or in those circumstances. But people don't understand that you can have grief in your life because something else is gone. And you mentioned grief in terms of when you got your diagnosis. You said there was a lot of grief. So, what exactly were you grieving at that point?
The person I thought I was, like,
Mm,
I was 19 years old with my bipolar diagnosis and about 30 something with my schizoaffective. And
hmm
I had gone 19 years thinking I was, quote, normal,
uh-huh,
going through the motions, and then all of a sudden you're slapped with a label and told you have differences and forced to take medication and forced to have different ways of living. And it's a grief process from what you've known your entire life to something completely different and having new obstacles. And I think it was an even bigger grief process when I got my second diagnosis. I had
Mm-hmm.
made peace with bipolar, but
Mm-hmm.
I was very afraid of the word schizophrenia.
Mm-hmm.
And having a completely unknown term and finding out in a roundabout way really put a lot of, I was in denial initially, then I
Mm-hmm.
was fearful, then I was sad. And it
Mm-hmm.
was just this roller coaster of emotions of what is my life really going to look like now?
Yeah. So you have this idea of, like all of us, we have this kind of hopes and dreams of what we're going to become, what our life's going to be. Like, we're going to have a family, we're going to have a job, the things you enjoy doing in life, hanging out with friends, you know, going to the movies, doing hobbies, those kind of things. And like you said, when you get a diagnosis, there's a label to it, and a stigma with it. And so you experience the grief of those ideas of what my life was going to be or how it is now has to change. And it's no longer that. It's going to be something else. And you don't know what that something else is. Yeah. And and you mentioned too, like the label of schizophrenia, how scary that is for people. And I think, again, that some of that, I think, comes from, movies and TV, where every serial killer in a show or a movie, or anybody on TV, that automatically it's, oh, they're schizophrenic. That automatically means they're just like ultra violent and killers, out there, uh, wandering around at night, and which is absolutely not true.
Yeah.
Uh, it's 1 million times scarier for the person that's dealing with it than it would be for anyone else.
That's so true. And I really didn't have a clear understanding of what it meant to be live with schizophrenia, right?
Mm-hmm.
Like I had only met one person living with schizophrenia. It was a brief encounter, and I had heard stories, like you said, in the media. Oh, people with schizophrenia are dangerous. People with
Mm-hmm.
schizophrenia are crazy. They're, and that people always say not normal, but
Mm-hmm.
what I've learned along the way is I might have schizophrenia, but I'm still a human being, and I'm a lot more likely to harm myself than I am anyone else. And I don't know that I've ever met someone living with schizophrenia who really would harm anybody else.
Mm-hmm. Yeah. Same here. Same here. And then one more point of discussion that I think was important. You mentioned the idea of wearing a mask, and this is a term that's kind of gained popularity in the past few years, and that's of masking. And it's this idea of, if you're struggling with a mental illness or a neurological disorder, you have to put on this mask when you go out in public. And I don't mean just literally like walk outside or walk to the store. I mean, like, mostly in professional and social interactions, because people expect you to act a certain way. When you're at work, you're supposed to be, you're supposed to have it all together. It's not really accepted to have an emotional problem at work.
Right,
If
right.
if you start, getting angry or crying at work, your boss is most likely say, "Oh, do you need a minute? You can go to the break room and take a minute." You know, and then come back and get back to work. It's just, that's what's expected. But also your social interactions. In other words, we have these social norms that are like, we want to be cordial with people, but there's kind of like this fine line, this balance between sharing too much. You hear TMI, there's too much information. And so, even for a person that is not struggling with a mental illness and emotional dysregulation, sometimes those things can be tough to juggle, you know. So imagine having uh, this problem, this struggle within that involves, you know, your emotions and your thoughts and perceptions, and trying to figure out, okay, well, how do I do this and, you know, still be myself. Uh, what is How does it feel? Like you mentioned, coming home after a day out of wearing this mask, how does that make you feel?
It was so draining. When I was in school as a child, I was a lot more reserved when I wore my mask. And when I came home, my parents really went through it with me. One minute I was screaming, one minute I was crying because I was not yet regulated at all. I wasn't in treatment at all. And I had worked so hard during the day to keep it all in and to
Mhm,
hide it all that by the
mhm,
time I got home, I had no self control left. Like it was
mm,
just done, and it was my safe place. So deep down, I thought, okay, if I'm going to let it out anywhere, it's going to be here.
mhm.
And then as an adult, when I was working, I really had to keep that mask on because the stigma was so high. And it was just not professional to let it be known you had any kind of problem, let alone serious mental illness.
Yeah.
And it was so draining doing that and being quote normal at work that when I got home, some days I couldn't even speak when I got home. My husband would talk to me and I couldn't respond. I was so drained and stressed out.
Mm,
And it really left me pushing myself to a limit that was unhealthy doing this.
yeah.
And then I had nothing left. And I'm like I said, I'm a compulsive thinker. And when I get really stressed out and like that, suicidal ideations pop in my head. And there was about a year period where that's all I could think about. Like the public didn't know that. I didn't let
Right.
that be known at work. So when I got home, that's all I could think about. And it was really a reaction to the trauma, to the stress, to not being who I am and not getting the right help. And a lot
Yeah.
of that boils down to wearing that mask most of the time.
Yeah. Yeah. And I think you hit the key point there at the end for people that do struggle with that is if it's to the point of being overwhelming, then you're probably not getting the right help. You're probably, you know, not where you need to be in terms of self-regulation and finding that balance. So yeah, definitely. Uh, if you're feeling like that, it's time to look into, yeah, okay, what else do I need? Because this is something I'm having to do that's literally just draining me, you know, mentally, physically. Which actually leads us to kind of where we left off at the other part of your story. You talked about there not being enough resources in certain areas. And
Right.
so you began, once you kind of passed a certain point in your healing journey where you were back on the go, you were, you know, moving in the right direction in terms of growth and healing. You started looking into this more. What did you discover in terms of your research on the subject, and how did that lead you to where you wanted to start your own nonprofit?
It really started with me just being vocal more than I was. And I started the day program. And then I went back to work and I started opening up there. And I was met with such warmth and compassion.
Hmm.
And it really left me wondering why I was silent for so long and why there weren't more voices. And I really questioned, I live in a rural area. Why do I have to drive an hour to see a provider who's equitable? Like, why
Hmm.
is that not where I live? And I wanted a world where no one else had to go through what I went through and live in silence and not get services and suffer because of it. So, my initial idea was to form this nonprofit for a support group for people like me. That was where it all started. And along the way, I figured out that this could be bigger, a lot bigger. And so I got into graduate school, and my initial idea was to provide free therapy on a grant based level But what I've learned in my program is that my experience and my voice is unique.
Hmm.
And therapy isn't for me, but advocacy sure is.
Uh-huh.
And and in 2024, I opened that free support group. And it's for people living with schizophrenia, schizoaffective disorder, and bipolar disorder. It's online, and all of my services are 100% free because I personally feel that mental health care is far too expensive.
Hmm.
I didn't choose to need these services, so why should I break the bank trying to survive? And it was pretty successful. So now we have three groups. Two are two general in-person umbrella mental health groups and are online for serious mental illness. And I will grow until I just can't, because I feel like having a safe place for others heals me too. It's not just about the healing for them, it keeps me healthy too. Service work is a important part of my recovery.
Yeah. Yeah. That's awesome. That's awesome work. I'm very proud of you for doing that and doing that work. And I'm sure there's people that you're helping, even if they can't verbalize it at a certain time, that are very appreciative.
Definitely, yeah. I don't do it for a thank you, but when they progress or reach a goal, that's all I need.
Yeah, absolutely. So yeah, it's great to hear that you're doing that and helping out people. So how can people, our listeners, get in touch with you or support your nonprofit? What's the best way that they can reach out to you?
So our website has my email, my phone number, and our website is jesupport.org. All of our services are listed there. There's a way to contact me on there. Whether you want to be involved or donate or use the service, I love collaboration. I am willing to talk to anybody and help anybody in any way I can. If you have a like-minded mission and just want to chat, let me know.
Awesome. Thank you very much. And everybody, that link will be in the description. So you can go there and check that out. Definitely lend your support and encouragement. Maddie, thank you for joining us today. You definitely have a powerful and encouraging story. So I appreciate your time and your vulnerability and willingness to share that with everyone.
Well, I appreciate you having me. Thank you so much.
For our listeners, what resonated with you the most? What did you learn? Please tell us in the comments. And please subscribe, like, comment, and share to stay connected to this community of mental well-being as we all learn and grow together.